Namaste. To continue this discussion, I will like to add that the reaction of the woman is not the same at every time. She will react to the same situation in a different way because she is having different kind of hormones in her. The reaction to deal with a woman is not a simple task for a man because she reacts differently. At the age of menopause, it is very different. So it is the task for the man who are married, and they cannot understand because they are having only one hormone, that is testosterone, and she is having multiple hormones in her. So, and at that age of menopause, there is a storm going through. She is going through the storm. So now I will like to yes, like communication is the key. We have to counsel to the patient, and as good as her family also, her male partner also, because she devoted her life to you, childbearing capacity, and she is bearing the children, and then she is facing this problem, and it is not a disease, it is just a phase. And to make this phase very easy, we can share more and more tips on this. Let's start with the presentation. And this is a presentation, just a small presentation because the time is very less. Yes, what is menopause? It is the cessation of the menses more than 6 months to 12 months, provided there is no pathological, physiological, and also psychological problem in her. So I will like to add the psychological problem more because I faced one while consulting. I met one patient, and she was high court lawyer, and at the age of 38 she suddenly ceased her menses, and she was not having the child also. So she rushed to our clinic, and while taking her history, she was a brilliant and dashing lawyer, and everything was in her favor, but at the same time the case was against her, and she lost that case, and she cannot cope up with that trauma, mental trauma, and she cannot take it sportively, and as a result her menses ceased. And then again giving her taking her psychological factors in the consider, and giving her treatment, panchakarma, shirodhara, everything, and then she again started her menstruating normally, and then she got her child also. I met 4 to 5 patients who due to the demise of her immediate partner or child, sudden psychological trauma, menopause was there. So this may happen in case of menopause. Now we will see what Ayurved says. Acharya Shusruch said it is Rajo Nivrutti. It is said that Jara Pakva Shariranam Yati Pancha Shataha Kshayam. So Jara yane I am sorry. Jara, it is old age. Old age 50 to 55. It starts from Panchashataha, that is 55 years. From over the year of age of 55, it is said that she is now in old age, entering in old age. Pakva is ripe fruit. I will like to emphasize on this Sanskrit word because it is typically used for a fruit, and that is right. You can easily observe in nature that it is having the wrinkles on it, it is sweet in taste, it easily detaches from the tree. Similarly, this description also we can apply to the Rajonivrutti woman, that is menopausal woman, and this phase is called as a Vata phase. So we have to see what are the attributes of Vata. Then what are the attributes? While describing the attributes, Acharya Ashtanga Hridaya Sushruta chapter 1 12th shloka verses Tatra Ruksho is dryness. To encounter this Ruksha guna, increased Ruksha guna, one has to, the patient should eat more and more unctuous food. That is, she should add ghee to her food, use more and more cheese. Then she can use extra virgin olive oil in her diet because she is having wrinkles over her body, skin also, but inside the body there is tremendous dryness. So we have to consider this dryness. Then she can use butter also, but ghee is the best she can use. Then omega-3 oil she also can use. Then food that is freshly cooked she can use to for this laghu guna, that is easy to digest. She has to eat the food that is guru in gun, that is not easy to digest, and it will increase her earth primordial element in her body after digestion. For example, we can advise her, counsel her to take the food that is more and more having earth primordial element, that is dry date powder, or that sweet in nature, unctuous and sweet. Then she is having the sheath, that is coldness in her palms and feet also. So she has to rub dry ginger powder on her palms and feet. Then to encounter this khara guna, khara, that is roughness of the skin, she has to apply oil on her skin. Skin is also a seat for vata, so application of oil on her body will reduce and will slow down the process of aging. Then so for that we are on sukshma, that is micro level. So one should eat macro, that is which will attribute more and more a macro. Then chala guna, that is from moving here and there, you can easily observe she cannot focus on one object, that is chala guna is increased. So she should not travel more and more. The overthinking is there, you can easily observe all this. Then we have to arrange the diet and regimen accordingly. Now moving to the next slide. Yes, in woman, I said you that journey of the womanhood is not so easy. First of all, she is in childhood, the kapha dominant phase. Then you can easily observe a baby girl while playing, she will play with the dolls, she will play the drama, and in that drama she will prepare different kind of recipes, because she is having the extra exclusive capacity of bearing the child. In Ayurveda, it is described as prasava dharma charini. So it is in her psychological, mental and physiological, and also body, feminine characters are there. Then after that childhood, finishing the childhood, she will enter in the menarche phase. That is a pitta. Pitta will start into role. The pitta, you can easily observe due to global warming, the age of menarche is coming earlier. Ideally it should be up to 12 to 16 years, but nowadays, due to exposure of social media, knowing all those sexual things, and very easy they can observe. Then due to non-genetically they eat to genetically modified food, so the changes in her body become more prominent, and the age of menarche is becoming earlier. At this age, her conversation with her mother is very important, and all these phases need a good doctor or vaidya who will counsel her in each and every phase as a friend. This phase is vata, this phase is pitta, and you should eat this, you should not eat this, and she should talk to her frequently for this, and she can take the consultation also, because every phase is not so easy for her. And if there is no menarche up to 16 years of age, her mother should took her to the doctor, because I met one patient just now. She was 21 years old, Ayurveda first year student, and she was not having menses. She not started the menarche, and on sonography she got that she was having the uterus, endometrium, but no cervix at all, and no vagina also. But as a result, at the age of 21 years, she has to undergo the treatment of hysterectomy and again vaginoplasty. So it is the mother's role is important in this case. Then comes the menstrual and fertility phase. In this phase, pitta is more dominant. So pitta is more prominent. Then perimenopausal age. Perimenopausal is a different thing, and I will like to focus on this and postmenopausal phase, because she cannot, she cannot accept the fact that her menses are irregular. Sometimes they will come in 10 days, sometimes there will be 2.5 months also, and if there it is, sometimes it is heavy and sometimes it is less, so scanty. So she should be always prepared. She cannot plan for travels, she cannot plan for important meetings abroad, traveling or any family get-togethers. She is always stressed of these things. Then comes the postmenopausal phase. So, what are the general symptoms regarding the menstrual cycle? Because the Dr. Neil Kumar gave me this subject, that I have to speak on this subject more. Irregular cycles with or without excessive bleeding, sudden cessation, gradual hypomenorrhea and gradual oligomenorrhea. If there is excessive bleeding, one should advise her to take more and more astringent nature food or decoctions. You can easily advise her to take black coffee, a shot of black coffee, then astringent rice water, then nakeshar you can advise her, so the bleeding will stop. But here, instead of going for hormonal treatment, hormonal replacement therapy, Ayurveda is having the fantastic solutions for this, overcoming this phase. Then you can see the physical, physiological and psychological symptoms. The physical symptoms are obesity. Suddenly she will start having the deposition of the fat on her abdomen, belly. Then skin aging. Here she should exercise daily, but it should be half of her exercise. Exercise should not be for the burning of the calories. I met one patient, she was from Encinitas, she was 65 years old, and after eating she was running for 5 miles in order to burn the calories, but at that time she cannot digest her food easily. Here consultation and counseling is very important. Then skin aging. Skin aging is a major concern. Many women underwent the Botox therapies or some cosmetic surgeries. But a simple trick is that you should apply the available oil on your skin towards heart, from the bottom and around the belly. And after that, don't use any kind of body wash or any kind of soap. So there will be a protective layer on your skin. Instead, you can use Trifala Churna as a scrubber, or Uptan, that is for Udvartan. It will demolish the fat underneath the skin. Or if you are living in a hot, if the weather is hot, you can use the sandalwood powder with rose petal water and apply it on your skin. So otherwise, red lentil powder and skimmed milk also, and a pinch of turmeric, it will useful for increasing the fairness of your body. Then thinning of hair. She will hair fall starts tremendously, then less hair on head and more on face. And it is a very awful situation one has to face, because she lose the confidence while speaking on the camera also. So sagging of the breast. Then there should be a massage of oils, and cupping therapy also gives the good results. Dryness of the vagina. For overcoming this dryness of vagina, there is a fantastic remedy for this dryness of vagina. There is Uttar Basti, that is a patented Uttar Basti instrument prepared by our clinic, and one should use this to there will be unctuousness, there will be no pain during intercourse, and it is the key for conversation and everything. So to overcome this dryness of vagina, one can use the Uttar Basti treatment also. Then there is a hoarseness of voice also, voice changes. Then she is having the hot flushes. She should avoid the spicy and heat food. Then she may feel that there are many sleepless nights, joint muscle aches, weakened bones, osteoporosis develops. She always feel that she is having the fatigue, palpitation, osteoporosis, urinary changes, digestive changes because food is not digested easily, excessive sweating because she can wake up in the night or at the night also due to this excessive sweat. sweating, then cold extremities and loss of libido. To overcome this loss of libido, we have to give her medicines that will increase her interest in the sex also, and it will encounter that overcome that dryness of vagina. Psychological factors are also there. She cannot cope up with this phase. Sometimes she feels very depressed, mood swings are there, then irritation is there, trouble focusing, mental fog is there, low self confidence. I remember one patient, she was a gazetted officer and she was directly reporting our Prime Minister, respected Modi ji. But at this phase, by overcoming this phase, and 1000 people, staff was under her, working for her. But when she visited our clinic, when she was walking, her husband took her with support, and she cannot walk 2 steps straight. And we gave total complete treatment as a basti, shirodhara, counseling, and internal medicines that will increase her self confidence. And after that, she danced beautifully in her daughter's wedding, and she told me that, oh my doctor, this is, madam, this is due to you. I said, no, it is Ayurved, not me. Then how to deal with it? You can eat warm unctuous food, skimmed milk, ghee. If ghee is not available, you can take unsalted organic butter and boil it and prepare a ghee. Add tulsi leaves to it and prepare ghee also. The diet that will be having high protein also, broccoli, cauliflower, asparagus, kale, but you should eat it after boiling, because it will be after boiling, Agni Samskar will be there, fire element will be activated, and it will be easy to digest. Flax seeds having omega 3, so one can prepare chutney from flax seeds. Tulsi seeds will be, you have to soak the tulsi seeds half teaspoon at night, and she can eat in the morning, because it will overcome her heat in her body. Here, by understanding the heat, the main culprit is Vata, not Pitta, but it takes the Pitta from its place and to the skin, and she feels that there are hot flushes. So here you can advise her tulsi seeds, brown rice, fruits, black raisins. Here she feels that she is having constipated, so you can advise her black raisins with seeds. Soak it 10 to 15, 20 to 25 at night in water, and chew it in the morning. So it will be easy for her to pass the stools. Then dry fig, almond, and also different kind of porridges. Then lifestyle changes, she should do the yoga and exercise. Different kind of yoga are very useful to understand this phase. You can advise her to do butterfly, Vajrasan. It will, after eating, she should eat in Vajrasan for 10 minutes, and it will pass the gases. So neck exercise, that will be helpful for her. Surya Namaskar, because it is a complete pranayam also, and it gives hormonal balances to be in everything in balance. Then she should do Naukasan. It will give pressure on her lower belly, and it will be useful not to use, it will not allow to deposit the fat on her lower belly. Then Tadasan for balancing her body. Then Ardha Vajrasan for the low back exercise. Parvatasan and cycling in the bed, that will increase the blood flow towards the uterus. Then she should practice daily meditation. Then pranayama. First she should do Kapalabhati, but it should not be excessive Kapalabhati, not for half an hour, because we are not yogi. It should be a 10 to 15 times Kapalabhati. After that you can perform Anulom Vilom and Dirghashwasan, that is a long breathing, deep breathing. And after that one should be the focus. Brahmari pranayam is also important. Then she should take proper sleep. If she is not having the proper sleep, she should use nutmeg powder with water and apply it on her forehead for proper sleep. She can use yoga nidra for proper sleep. Then one can advise her to take a hot milk with turmeric for proper sleep. These are different kind of foot massage is also helpful for proper sleep. Then what is the treatment protocol? Here in India, we advise her to take the Matra Basti that will delay her aging process. Uttar Basti that will overcome her dryness of vagina. At the same time, it will not allow the shrinkage of ovaries. It will delay the process of aging of ovaries also. So the overall process of aging delays. Then the Shirodhara, it is a medicated oil treatment on her forehead. It will help her to all the hormones to balance, and at the same time she will experience a deep sleep also. So it is a unique specialized treatment of Ayurveda. It is Uttar Basti. It will encounter the dryness of vagina, for loss of libido, for fibroids, endometriosis, adenomyosis. Adenomyosis is nothing different that it is a Vata. Vishet, all these are having the Vata. So Basti Chikitsa is half treatment for Vata. So to improve the overall uterine health, she will not face the problems like endometriosis, adenomyosis, shrinkage of uterus, and to improve the uterine health. For Rasayana Chikitsa, it is used. So it is a unique design for painless procedure without any complications. It does not require any OT setup. It is pre-sterilized and pre-filled also, and it is easy to use. It is we are having the patent of this instrument just in last month only we got this patent, and it increased the success of treatment. If there is a repeated IVF failure cases, increase the endometrial receptivity, we can easily advise her to take this repeated cycle of Uttar Basti. And in I said it that in menopausal woman also it is very useful. I think my time is up now. So thank you. If you are having any kind of questions, please continue.